This video is an extract from the book A Short Walk with Death by Ronald E. Quist. With a confident gait and purposeful steps, Death made a bold entry into the doorway of my private hospital room. I noticed him immediately. In my 69 years of life, no one had yet schooled me on the correct protocols to follow when encountering death. A cheery greeting "good morning" seemed inappropriate and unmindful of the present context and circumstance. On the other hand, entirely ignoring Death's arrival struck me as rude. I settled on a nod of my head in his direction to acknowledge him. His response was neither warm nor friendly. He was here to do a job. Taking on a neutral air and appearing neither aloof nor engaged, he returned a slight nod of his head in acknowledgement of my gesture. It was still dawn. It was Monday morning, the 9th of December 2024. 8 days earlier, Razak rushed me to the University of Ghana Medical Center, which admitted me. I suffered acute pancreatitis symptoms. My deafening, piercing, persistent screams at the time of my arrival at the hospital were possibly what drew Death's attention to me as his potential candidate. The screams also put the friends who registered me in the hospital on notice that my condition was serious. They must promptly reach out to my family to let them know. My friend Charles immediately notified my brother Michael and sister Marjorie. There was no wife, or partner, or adult children in Accra to reach out to. My parents had long passed away. I lived alone. A couple of hours passed after my arrival at the hospital with me screaming in the lobby of the emergency ward at the top of my lungs before medical staff quietened me down with a morphine shot. My screaming brought more irritated responses than looks of sympathy from other patients and their accompanying family members waiting for attention. Somehow, rumors spread that I was suffering from pancreatitis. The presumed cause of my symptoms was alcoholism, a clear sign of a weak character, an irresponsible lifestyle, and reckless behavior. Undoubtedly, such behavior was deserving of contempt. My story was quite different from their presumption. Gallbladder stones blocked my pancreatic duct, leading to my condition. Of course, it was not possible for anyone in the emergency ward lobby to be aware of this. Nothing about me announced that I was a teetotaler. My extreme pain arose from a host of factors. My blocked pancreas activated digestive enzymes, which normally only become active upon their arrival in the small intestines. The premature enzyme activation inside the pancreas led to the autodigestion of my pancreatic tissue and the irritation of nerve endings. My subsequent severe inflammatory response caused the pancreas to swell and stretch the organ's capsule with its rich supply of sensory nerves. The stretched capsule triggered powerful pain signals. The pancreas's proximity to a dense network of nerves, including the celiac plexus, did not help the situation. The inflammation and swelling triggered inside me a strong, radiating pain. The pancreas's anatomical location deep in my abdomen behind the stomach only amplified the pain. The inflammation affected nearby structures such as the duodenum, bile ducts, and the lining of the abdominal cavity. The blockage of the pancreatic duct greatly increased the pressure within the pancreas, further intensifying the pain. I developed a dangerous secondary reaction, a large blood clot in my portal vein. The portal vein carries blood, rich in nutrients, from the gastrointestinal tract, pancreas, and gallbladder, to the liver for metabolism. This condition, referred to as portal vein thrombosis, could lead to impaired liver function, varices that could rupture to cause life-threatening bleeding, fluid accumulation in the abdomen, and intestinal tissue death, due to the lack of adequate blood supply. Just 6 weeks prior to this admission, I spent a week in the same hospital due to pancreatitis, so I was familiar with these symptoms. However, my previous attack was not nearly as severe. During my previous admission, the doctors surmised that my attack had come about due to the passing of a gallbladder stone which blocked the pancreas duct feeding into my duodenum. My prescribed fasting for the first couple of days of my admission to hospital was to rest my pancreas. The medical staff administered intravenous painkillers and antibiotics to treat the resulting inflammation and infection. The treatment adequately addressed my body's inflammation reaction. The doctors discharged me after 7 days. I plan to travel to Switzerland for laparoscopic surgery on my gallbladder in January, a couple of months away, after my daughter Charlene's university exams. She was in her final year at the University of Zurich. She would act as an interpreter and help me navigate the Swiss hospital and healthcare systems. On this second admission to the University of Ghana Medical Center, the doctors discovered significant necrosis of my pancreas. I had lost 30% of my pancreatic tissue. The loss of such a significant portion of my pancreas due to necrosis could affect my ability to produce insulin. There are pancreatic islets, which contain insulin-producing beta cells scattered throughout the pancreas. I faced the risk of substantial insulin deficiency, but that was a worry I could postpone till later. This time the doctors intended to undertake surgery to cut away the dead parts of my pancreas and to remove my gallbladder where the causative small stones were being produced and sequestered. The lead surgeon announced that laparoscopic surgery was not feasible. They would have to open up my abdomen. While I had faith in Ghanaian medical diagnosis and surgery, I was deeply concerned about the post-operative care. However, before the surgery could occur, they would need to stabilize me. My acute inflammatory response and the ineffective treatment soon seemed to undermine any hope of achieving that. Soon, I was flirting with death, or should I say, death was flirting with me. With purposeful steps and absent of any fuss or drama, Death had made his way into the doorway early that morning, though not through it. He just stood silently in the doorway with his gaze fixed on me. I raised my bowed head to see who had shown up as I sat forlornly on the side of the bed. He did not have to explain to me what his mission was that day. I knew I presented a sorry sight as I sat on the bed, bare-chested and barefoot in just a pair of khaki cargo shorts. I had electrodes attached to my chest and an infusion block inserted at the top right side of my torso, located just below my neck. There were intravenous tubes connected to 2 drip bags hung up on a metal stand, one with a saline solution and the other with a painkiller cocktail. I sat there, hunched over, exerting every effort I could muster not to become completely overwhelmed by the relentless, excruciating pain, which was caused by the insertion of an oversized nasogastric tube through my left nostril into my stomach. I looked up towards the doorway periodically to see if Death still stood there. The loud clacking racket was caused by an oxygen pump attached to the wall next to the head of my bed. There was a tube from my oxygen mask attached to the pump. My hyper-inflammatory reaction of my pancreas and intestines had swollen my stomach to the size of a woman who was 9 months pregnant with twins. I had grossly swollen hands and feet to match. My lungs had started to fill up with fluid a day earlier, so they put me on an oxygen feed. Still, my breathing remained labored. The clock on the wall ticked away whatever limited time I had left. Death didn't seem to be the type to tolerate being kept waiting. He still stood in the doorway.